Respiratory infectious disease. The learning outcomes of this session are to recognise the signs and symptoms of respiratory infectious illness, including COVID-19. Standard and transmission-based precautions. Correct procedures for using PPE. Prevention. Practicing regular, effective hand hygiene is the most effective way to minimise the spread of infections by healthcare workers. Practicing social distancing. Avoid droplet infection by being 1.5 metres away from other people and avoid large gatherings. Practice respiratory etiquette, using tissues and hand hygiene following coughing and sneezing, and effective immunisation programs. We also have 10 ways to reduce your risk of coronavirus. Of course, this also applies to the normal influenza and other infective respiratory illnesses. Wash your hands often with soap and running water for at least 20 seconds. Dry with paper towel or a hand dryer. Try not to touch your face, your eyes, nose and mouth. Cover your nose and mouth with a tissue when you cough or sneeze, and if you don't have a tissue, use your upper sleeve or elbow. Isolate yourself at home if you feel sick, and if you take medication, ensure you have adequate supplies. Phone your GP first if you need medical attention. They will tell you what to do. Continue healthy habits, exercise, drink water, get plenty of sleep, and quit smoking if you're still a smoker. Don't wear a face mask if you are well. Use alcohol-based hand sanitizers with over 60% alcohol. Get the flu shot when it is available in April. Avoid shaking hands and practice social distancing. Signs and symptoms of influenza, which can affect both the upper and lower respiratory tract, commonly are fever, general muscle and joint pains, cough, shortness of breath and breathing difficulties, sore throat and headache, and in more severe cases, infection can cause pneumonia, secondary bacterial infections, or primary influenza pneumonias, severe acute respiratory syndrome, and kidney failure. We will talk about the specific COVID-19 symptoms at the end of this session. Mode of transmission for infectious respiratory illnesses is through droplet and contact. And sometimes we have airborne precautions that we'll take as well. So our standard precautions, these are our day-to-day work practices required for infection control when caring for all patients and residents. Hand hygiene, I've said this 3 times already, but I will say it again, washing your hands with soap and water or using hand sanitizer often. Also ask your patients and residents and their visitors to do the same. Using the personal protective equipment as required, appropriate handling of sharps and waste, and also our cleaning regimes, and immunisation programs. Along with our standard precautions, transmission-based precautions may be indicated. These are contact precautions for when patients may have microorganisms in the bowel or on the skin which could infect other people. Droplet precautions, the patient has an infection which is spread through the air when they are coughing or sneezing, and that also by contact with soiled surfaces. And airborne precautions, the use of our respirator masks is for serious respiratory infections that spread through the air. Using personal protective equipment, I'm going to show you a 7-minute video for our standard precautions on what to use, how to put on and take off your personal protective equipment.
This video will show you how to use personal protective equipment when using standard precautions. Standard precautions are the main way to reduce the risk of transmitting infectious agents in healthcare. They are used for all patients irrespective of their known or suspected infectious status. Personal protective equipment, or PPE, is a component of standard precautions. You need to wear PPE to protect yourself when you think you may have contact with, or will be, handling a patient's blood or body fluids. In this video, we'll show you how to put on and remove gloves, aprons, gowns, eyewear and surgical masks. If you anticipate or know you are going to have contact with a patient's blood or body fluids, you must put on gloves. Firstly, remove all wrist and hand jewellery. Perform hand hygiene and wait for your hands to dry. Choose the correct size gloves and remove them from the box. Slide one hand into a glove so the cuff covers your wrist. Repeat with the other glove. When you have finished with your gloves, use your non-dominant hand. Remove the first glove by pinching the inner wrist part of the cuff on your dominant hand. Roll the glove down over your hand and scrunch it into the palm of your non-dominant hand. Remove your second glove by placing your fingers under the cuff on the inner wrist and roll it from your hand over the first glove that is cradled in your palm. Dispose of the gloves directly into the waste bin. Perform hand hygiene. Apron or gown. If you are anticipating contact with a lot of blood or body fluids, including aerosol, splash or splatter, or you need to protect your clothes from fluids, you will need to put on a sleeveless apron or, in some circumstances, a long-sleeved gown. To put on an apron. Unfold the apron, place your head through the opening, grasp the ties and tie securely at your back. To take off an apron, perform hand hygiene. Break the side of the neck strap. Roll the apron away from yourself down to your waist. Break the waist tie. Continue rolling the apron away from yourself into a ball. Dispose of the apron directly into the waste bin. Perform hand hygiene. To put on a gown. Unfold the gown. Slide your arms into the armholes and through the cuffs. Secure the top of the gown at the back of your neck with the ties, tape or Velcro. Grasp the waist ties and tie securely at the middle of your back. To remove a gown. Perform hand hygiene. Undo the waist tie of your gown. Undo the neck tie, tape or Velcro. Pull the gown away from your body. Pull your arms out of the gown, turning the sleeves inside out. Roll the gown down away from your body. Continue to roll until the gown is in a ball. Dispose of the gown directly into the waste bin. Perform hand hygiene. Protective eyewear. If you think blood, body fluids or any other fluids may splash or aerosolise into your eyes, you will need to put on protective eyewear. If you wear prescription glasses, put the protective eyewear over them. Remember to perform hand hygiene prior to and after removing eyewear. Surgical mask. If you think you may get splashed or have exposure to aerosolised blood or body fluids around your nose or mouth, you should put on a surgical mask. Remove prescription glasses if you wear them. Remove the mask from the box. Hold the mask with the pleats facing away from you and making sure the metal nose wire is at the top. Slightly bend the nose wire to form a gentle curve and open the pleats by pulling down on the bottom of the mask. Place the mask over your mouth and nose and pinch the curved wire on the bridge of your nose. Take the two top ties of the mask and tie at the back of your head, making sure the ties are above your ears. pull the bottom of the mask so it fits snugly under your chin. Take the bottom ties of the mask and tie at the back of your neck. Gently press the nose piece to conform to the bridge of your nose and cheekbones by pressing down with fingers until it fits snugly. Put on your prescription glasses if you wear them. To take off the surgical mask, perform hand hygiene. Remove prescription glasses if you wear them. Perform hand hygiene. Undo the bottom tie at the back of your neck. Undo the top tie and hold onto the ties. Lean forward and pull the mask away from your face. Holding only the ties, place the used mask directly in the waste bin. Perform hand hygiene. Please remember to refer to your local infection prevention and control policies and procedures, as well as these videos.
Okay, we'll just go through the correct order to put your PPE on and remove. So fitting in this order, wash your hands or use an alcohol-based rub. Put on your mask or your respirator mask, goggles, then gown and gloves as required. Removing in this order, your gloves come off first, wash your hands or use your alcohol-based rub, remove goggles, gown, mask or respirator, and then wash your hands or use your alcohol-based rub. Mercy has updated the management of outbreak procedure as above. The new definition is as follows. A potential COVID-19 outbreak is defined as 2 or more cases of acute respiratory illness in residents and or staff within 3 days. And a confirmed COVID-19 outbreak is defined as 2 or more cases of acute respiratory illness in residents and or staff within 3 days, and at least 1 case of COVID-19 confirmed by laboratory testing. Acute respiratory illness is defined in the COVID-19 guidelines as shortness of breath or cough. So we need to have a reminder that we need to be really alert for the signs of acute respiratory illness in our residents. So COVID-19 is a contagious viral infection that generally causes respiratory illness in humans. Presentation can range from being asymptomatic to severe illness with potentially life-threatening complications, including pneumonia. It is spread through contact with respiratory secretions and fomites. The most common signs and symptoms include fever, but these actually may be absent in the elderly, and dry cough. Other symptoms can include shortness of breath, sputum production, and fatigue. Less common symptoms include sore throat, headache, myalgia, chills, nausea or vomiting, nasal congestion, diarrhea, hemoptysis, and conjunctival congestion. Older people may also have the following symptoms: increased confusion, worsening chronic conditions of the lungs, and loss of appetite. Elderly patients often have non-classic respiratory symptoms, so we should also consider testing any resident with any new respiratory symptom. Surveillance for fever or acute respiratory illness, with or without fever, rather than influenza-like illness, is very sensitive for detecting possible cases of COVID-19 in the context of confirmed local transmission of COVID-19. Effective surveillance will facilitate early recognition and management of cases. Thank you very much.